friends. We're glad you're here. This is Ridgeview's podcast where we try to cover all things hope, healing, and recovery related. It's a delight to have back, after popular demand, Richard Moseley. Good to have you back.
Thank you for having me.
Absolutely. So, just a couple weeks ago, we published your episode where you talk about sharing your story. And, man, what a lot of great feedback we've gotten about that episode, not only internally, but externally. A lot of folks have seen that. Also with the state, they certainly acknowledge and appreciate the importance and courage of sharing one's story. And some of our psychosocial rehab programming folks have been tickled to listen to someone they know. So, again, appreciate you doing that. We had agreed, let's have you back to do part 2, where we would talk specifically about the job, the role of the certified peer recovery support, and maybe even in particular the wellness coach aspects of what you do. So thank you for coming back. Let's just dive right in. So the first question is, let's just start with the basics. What is a certified peer recovery specialist?
So it's kind of somebody who self-identifies as somebody being in recovery from mental illness and or substance abuse. They may have a co-occurring disorder, which is both a mental illness and some type of substance abuse. And what they do is with this lived experience, they kind of see that they can offer their story as hope and as help for other individuals. So they go through this training to develop skills to help bring to agencies across Tennessee, and actually there's on a national level too, where they know that the people that can help people in a crisis or any type of area they need help in, it's basically the CPRS is this specialty that was created in Tennessee, Certified Peer Recovery Specialist for Tennessee, and that we assist in developing recovery goals. There's so many different things that we do, but basically the main thing is engaging people.
Yeah. You mentioned training. So is it a set number of hours that you have to go through?
Yeah, so that we get this good quality. The Tennessee Department of Mental Health and Substance Abuse Services, they kind of been part of this program. We developed a certification program where it's an intense, 40-hour training, and then they have to maintain their education through CEUs so that we maintain that good quality of individuals. Because when we certify, we go through all walks across the multiple agencies and trying to help individuals along with the recovery journey.
Yeah, so that's great. I think we shared in the link last time the canvassing across the state of where these services are provided, but you talked about Ridgeview specifically. So do we have specialists in all 5 of our counties?
Yes, we do. Yes, we do. I travel to all the counties as a CPRS and as a peer wellness coach. They're very similar, which we'll talk a little bit about soon. But we encompass in different areas. And the thing is that to get the specialty, to get the certification, is that anybody can get it in Ridgeview. If Ridgeview is one of those great, I love this agency that we offer anybody who wants to get the certification who works within Ridgeview, and that is just one of those tools that we can help individuals along with their recovery process. And so Ridgeview uses CPRSs in different ways. I'm a CPRS in my program. There's CPRSs at peer support centers, which is a place where people can help learn about they do recovery groups on mental illness and substance abuse and developing coping skills, anger management.
Yeah, and you mentioned other programs within Ridgeview. So even like the STOP program,
Yes.
Which is our community-based substance use treatment program, outpatient treatment program, the MISS program.
Yeah.
I can see how that would be really important and beneficial for someone wanting to connect with someone who has lived experience, how important that is.
Yeah, very much so, because we know that we can engage on a more personal level with an individual and kind of walk alongside their journey to be that support for them, because sometimes when you get sick, you just go from doctor to doctor, and you're kind of in this major, especially if it's if an individual who may just starting to have a crisis, or maybe had multiple crises, sometimes it's really hard to follow along where you may need to go in that journey. And so a peer support specialist really can be in any aspect of that journey, because one of the sayings that we have is there are many pathways to recovery. And because there's so many pathways to recovery, we see CPRSs in so many different areas across the state and within Ridgeview on how we can best use those services to help somebody in their recovery.
Yeah, no, that's a great point. You know, if I'm listening to this or watching it and I think, you know what, maybe I would benefit from the engagement of someone like you. What would I need to do? What would be the next steps?
Well, if you wanted to engage in a CPRS, like I said, not only within Ridgeview but across the state, there is almost every agency I've ever worked with has had a CPRS. And what they do is they go to the agency, and part of that intake process or whatever part they may be hospitalized, and we have CPRSs on IPU units and crisis units that normally when you're in contact with an agency, they can kind of see if they kind of offer that service to you. Would you like to work with somebody who's a CPRS who has this lived experience with the mental illness or substance use? And they can kind of also help you along in this process of trying to go through your recovery.
Great. No, that's really valuable. Well, you you mentioned, and I love the way you use the word engagement, because it keeps coming up, engagement. Now, as a peer wellness coach, what does engagement look like for that particular role that you do?
So one of the studies, there's been so many great studies on how we help people with mental illness and substance abuse. And one of the studies actually finds that adults with serious mental illness on average die 25 years earlier than the rest of the population. And 25 years is such a huge difference. And one of the things they created it was a federal grant and then it became a state grant, where we wanted to really help in that area. And that we saw this great thing called the mind-body connection, maybe why this is happening, where when you deteriorate or getting sick mentally, it can hurt you physically. And just vice versa, when you're physically ill, it does hurt you mentally. And so we kind of wanted to combat this horrible statistic of early death for people with mental illness and substance abuse, where we wanted to get somebody with lived experience, and that's what they did. Is I'm someone with lived experience, and I'm on my own wellness journey, where we try to combat this in different ways, and we look at it through the spectrum of 8 dimensions of wellness, where if you help somebody with one area, some way down the line is that you see them impacting the area that would help them the most.
Fantastic. Well, I know, one of the things that you have been involved with before, especially around that wellness exposure and engagement coaching. Ridgeview has hosted, in a previous episode, we talked about the reintroduction of our 5K in the fall. And you have helped bring folks out to participate not only as walkers, joggers, but also as volunteers. What a neat, exciting, powerful way of engaging someone in one of those activities that can not only promote physical health, but also help optimize mental health.
Mm-hmm. Yeah, I really try to find ways that we can help people be more involved in the community, because sometimes, especially for me during my journey, sometimes I didn't feel like I was part of a community or part of a group. I was my own self and maybe my little family, but in reality, we're all part of this community. And so to kind of develop that community connection is that I thought, wow, we have so many people here in the community that have this lived experience who would benefit greatly and understand that they are part of this community, especially in Oak Ridge, where Oak Ridge is amazing in this, where they try to help individuals with mental illness and substance abuse. So many programs that I also want, it's important that we allow them to know that they're part of our community, and that's why we want to have this shared human connection and take care of each other.
Well, that's beautifully said, Richard. As always, I think, you're take this news and this invitation back to the folks that you are working with, that, we'd love to have them back out in whatever role they would like to participate. And we'll put the links in the bottom of the post when this episode so that folks can go register as a volunteer or as a participant. Well, this is great. So tell me just a little bit about this T-shirt. So Nathan brought this by, and I just love this, and I'd like for you to just tell us a little bit about it.
So this is what my brand is called, My Health, My Choice, My Life. And what it is that I try to find some way to celebrate everybody's accomplishments. So as a peer wellness coach, everybody is part of their own wellness journey, and I use so many different tools to help somebody along in their wellness journey. So what I like to do every year is I like to celebrate everybody's progress that they made, because even a little bit of progress can have a huge impact on an individual. And it's amazing seeing the changes in individuals that I work with and my peers that I work with, that I wanted to find a way to celebrate what they've done. So what I do is I unfortunately, because of COVID, but in years past, I would we'd go and rent out a park. We'd take part in so many facilities encouraging that physical activity. We do art, because art is an amazing coping skill for a lot of individuals. And so I usually took some type of project to do. This year we made Zen gardens. A Zen garden is just a way to help with mindfulness. And I try to do something every year. One year we did, we got a ceramic boot and we planted to help grow something. So I try to find some way to help celebrate somebody's wellness journey. And that's what I do try to find something to do for individuals every year, encouraging those healthy habits. To help develop and continue that journey of wellness.
Well, I mean, it's, excuse me, it's great stuff. I mean, you know, you and I are both smiling ear to ear while you're talking about it, because it's such a positive, good, supportive, encouraging thing. And I say, keep up the great work. I mean, that's wonderful. And I'm sure the folks that are involved in this get a great deal of self-gratification and validation that what they're doing is making a difference, and that they're getting better. I know we're about out of time, and I see the 8 dimensions of wellness here. I guess, just as we concluded the last episode, where we talked about your story, but then we wanted to come back and have you talk about what is a certified peer recovery specialist. Maybe this can be a teaser for coming back again, is we can dive into, what are some of these 8 dimensions of wellness, because I love all of these, and they're all so important to talk about. So can we agree to, we'll make a commitment to do this again?
Definitely.
All right. Fantastic. Well, any other messages that you want to get out before we bring it to a conclusion?
I always love Ridgeview's motto is hope, healing, and recovery, that no matter how bad you are, there's always hope. There's always a moment of healing and recovery. I just love that, because it impacts me on a personal level of my own journey, but me wanting to share that with others, and knowing that there is hope, healing, and recovery, no matter how down you are, that there is a way back, and finding your happiness in life, no matter how bad you feel.
Yeah, I'm glad that resonates with you. We oftentimes, especially when we're doing suicide prevention trainings in the community, excuse me, where so many folks may feel hopeless, and maybe haven't experienced that feeling of hope in a long, long time. That, we often say here, right there, I'm holding hope, and I'm going to hold that hope for you till you're ready to hold it for yourself. And that's, I think, part of Ridgeview's obligation, duty, and even privilege for the community, for the people that it serves, is that we will hold that hope for you until you're ready to hold it for yourself. So thank you for bringing us to a conclusion on that note. I love it. So thanks, Richard. Let's get another round scheduled. And thank you for tuning in again, folks. We always appreciate it when you take time out of your day to listen, watch. Don't forget to let us know in the comments section other topics you'd like for us to cover. And if you're interested in the 5K scheduled for Saturday, October the 30th with a Halloween theme, please link through the go to our registration site through the links below in the description of this video podcast. Thanks again, folks. We look forward to seeing you next time. Take care.